So what did you do next?
Well, the first thing you should do in such a case is obviously refer the patient to the radiologist for an X-ray to see if there's a fracture or if there are metastases. For this patient, the X-ray was clean for metastases and it revealed a fracture of the fifth vertebra. You can do an MRI as well to be sure there's no tumour and to see whether it's a symptomatic fracture or not. But an MRI is necessary if you found out during history taking or on examination that the patient might have a tumour or an infection. Since she had a history of breast cancer, it's recommended to do one here. You should also ask for a CBC, calcemia, CRP, ESR, TSH, electrophoresis and tumour markers to rule out a relapse. In this case, the possibility of a tumour was ruled out and it clearly was not a symptomatic fracture. Now, given the underlying cause, you need to assess the degree of osteoporosis with bone mineral density with dual energy X-ray absorptiometry. So the patient had an osteoporotic vertebral fracture and it fits with the case. She was 65 with a family history of osteoporosis. The pain was acute and mechanical, and there were no general signs involved like fever, inflammation or weight loss. And of course the X-ray showed the fracture with no signs of a symptomatic fracture.
So what's the treatment?
Rest, medication and later on physical therapy. The patient was started on bisphosphonate calcium and vitamin D.
Are there any risks if it's not treated immediately?
Well, in some cases it can lead to deformity, namely a dowager's hump. But even when it's treated, the problem is patients start to live in fear. They're scared to move in case they break something else. So you need to talk to them to help them live with it. And of course, permanent disability sometimes occurs if it's not treated well or not treated soon enough. The problem is osteoporosis is usually asymptomatic, the first fracture being the first sign, so prevention is essential, especially in patients with a family history.